I've spent years listening to men quietly describe the same concern, often framed as just aging, even when their overall health looks fine. They talk about mornings that feel unpredictable, confidence that comes and goes, and a body that doesn't always respond the way it used to. Most expect me to talk about medication or hormones. Instead, I ask a question that catches them off guard. How do you sleep? Because, in my clinical experience, sleep position quietly influences circulation, nerve signaling, and hormonal rhythm more than most men ever suspect. I'm Dr. Sophia Ruby, and my work focuses on men's urological and hormonal health. Over time, I noticed a consistent pattern that wasn't obvious in textbooks but appeared clearly in real life. Men with steadier sexual health often shared similar sleep habits, not diets, not supplements, but body positioning at night that supported blood flow and nervous system calm. This isn't about tricks or promises. It's about removing nightly stress from systems that already work hard as you age. Sleep is not passive. While you rest, your body repairs blood vessels, regulates testosterone, and resets the nervous system. But certain sleep positions quietly interfere with these processes. Curling tightly, compressing the abdomen, or twisting the spine can restrict circulation for hours at a time. Over years, that repeated pressure matters. Many men do everything right during the day, yet unknowingly strain their bodies every night. Sexual health depends on calm nerves and steady blood flow. When sleep posture compresses the pelvis or keeps the body in a defensive position, the nervous system never fully relaxes. Stress hormones stay slightly elevated. Blood flow becomes less efficient. These effects are subtle, but the body remembers patterns, and as men age, tolerance for nightly stress decreases, even if nothing feels painful. I often hear, "I've always slept this way." That may be true, but your body at 60 responds differently than at 30. Blood vessels lose elasticity, recovery slows. Positions that once caused no issue can quietly begin to matter. This doesn't mean something is wrong, it means the body needs more support. And that's when sleep posture becomes clinically relevant. The twist is simple. The sleep position most associated with healthier nighttime function is side sleeping with neutral alignment, especially on the left side. This position reduces pressure on major vessels, supports venous return, allows deeper breathing, and keeps the nervous system calmer. It doesn't create results. It removes obstacles. And once men understand that difference, they stop chasing fixes and start supporting physiology. When you sleep on your side with the spine supported and the pelvis relaxed, circulation improves naturally. Blood moves with less resistance. Hormonal signaling becomes steadier. I've seen men report more consistent morning responses simply because their bodies finally had uninterrupted recovery time. No forcing, no promises, just cooperation with biology. And this is where the conversation shifts from anxiety to understanding my goals. Another factor I explain to patients is breathing. Side sleeping with proper alignment allows the diaphragm to move freely, which deepens breathing and signals the nervous system to shift into recovery mode. That shift matters. Calm nerves support healthy circulation and stable hormonal rhythms during sleep. When breathing is restricted by poor posture, the body stays slightly alert, and that tension carries into the next day. Testosterone production follows sleep quality more than age alone. It rises during deep, uninterrupted sleep and drops when rest is fragmented. Positions that compress the chest, neck, or abdomen interfere with that cycle. Over time, men may notice subtle changes in energy or responsiveness and assume age is the cause. In reality, the body may simply be missing consistent recovery signals. Pelvic comfort is another overlooked piece. When the pelvis is compressed for hours, blood flow becomes less efficient. Supporting the knees and keeping the hips neutral reduces tension in the pelvic floor. That relaxation supports comfort, circulation, and nerve communication. These aren't dramatic effects, but they are reliable when practiced night after night. So when men ask me if sleeping a certain way can really matter, I answer carefully, no position guarantees outcomes, but some positions protect function better than others. Side sleeping with neutral alignment removes nightly strain from the systems responsible for sexual health. And over years, reducing strain often matters more than adding interventions. I encourage men to approach sleep as quiet support, not a cure. Small adjustments, like a pillow between the knees or ensuring the neck stays aligned, can make a meaningful difference over time. These changes don't require effort once they become habit, and the body responds well to consistency. Resolution. Paragraph 3. Sexual health is not separate from the rest of your physiology. It reflects circulation, nerve health, hormonal rhythm, and emotional calm. When sleep supports those systems, confidence often improves naturally. Not because something was fixed, but because something was protected. If there's one lesson I want you to remember, it's this: your body doesn't stop knowing how to function. It simply responds to the conditions you give it. How you sleep is one of those conditions: quiet, overlooked, and powerful. And when you align your body with its natural design, you give yourself the best chance to age with steadiness, comfort, and confidence.